Before I get started, I'm going to ask the patient for their consent. Hello, I'm a student of physical therapy. Is it okay if I palpate your back and thoracic spine today?
Yeah.
And then just to be noted that the patient did consent. And so the first thing that we're going to find in our palpitation video is I want to find the thoracic spinous process. And so there's three unique anatomical structures we can help to find the thoracic spinous process. The first one is T2. In order to find T2, you've got to find the superior angle of the scapula. So I'm right here at the medial border of the scapula. I'm going to move superiorly and until I feel that angle of the scapula. And that's the superior angle of the scapula. And then I'm going to move medial to the spinal column, and this is going to be T2. And so that's just one. The other two we're going to find is the next one is T3. In order to find T3, I got to start at the spine of the scapula, and it's going to be in between the infraspinatus fossa and supraspinatus fossa of the scapula. And right here's that ridge, and I'm moving across it. And then I'm going to move medial, and this is going to be T3. Thoracic spinous process. And then the last one is T7. And so in order to find T7, I got to find the inferior angle of the scapula. And so I'm going to use the dip or the V in my hand. I'm going to move the scapula around until I have that inferior angle of the scapula right there at the dip of my hand. And I'm going to move down with my hand, down on it. And then I'm going to move medial back to the spinal column. And this is going to be T7 thoracic spinous process. Okay, and then I got I move down, it's TA, and then T9. And so I'm here at T9. I'm going to try to find the thoracic transverse processes. And so I'm going to do the rules of three. And so with the rules of three, if I'm here at the thoracic spinous process of T9, I'm going to move a whole spinal level segment. And so I'm going to have to move back up to T8, and then I'm going to move out laterally, and I feel a little bony prominence, and that's going to be the transverse process of the thoracic spine. And then if I move more laterally, I'm going to feel a hump, and that hump is actually an angle that runs off, angle of the rib that runs off the transverse process. And then as I keep moving over, the ribs, of course, move inferiorly and at a slanted, and that's going to be the shaft of the rib as you move laterally. And I can even move with my hand more flat so I can feel the shaft and the groove as it runs downward. And so here I'm here at the shaft of a rib, and if I move inferiorly down to the next rib, you'll feel a divot, a downward groove, and that's the intercostal space in between each rib. And then, so the last thing I'm going to find in the prone position that I have my patient in is we're going to find the rhomboid. So the first thing I'm going to do in order to find the rhomboid's muscles is I'm going to find the inferior angle of the scapula. So right here again is the inferior angle, and I'm going to move back medial to T7. And then from T7, we know that the rhomboid's fibers run downward from the medial border of the scapula. So as they're moving at a slant angle, I'm going to palpate vertically across the muscle fibers. And so in order to know that I found the rhomboid muscle, I'm going to have the patient place their hand behind their back. And then I'm going to ask them to lift their elbow up to the ceiling. Okay, and then relax, and then do it one more time, and then relax. And I feel that muscle pop up into my fingers, and that's when I know that I'm on the rhomboid's muscles, because they cause scapular retraction. So lastly, I got my patient in supine position, and the last structures I was wanting to palpate is a suprasternal notch. And so in order to find the suprasternal notch, I'm going to go in between the clavicles. I'm using the base of my fingers, and then I move medially, and then there'll be a dip there in between the clavicles, and that's the suprasternal notch. And I can move inferiorly down, and that's going to be the manubrium of the sternum. And then if I keep going inferiorly, there's a ridge right here, and right past beyond that ridge, if I keep moving inferiorly, is the body of the sternum.